Dear friends, good evening to one and all. I am Dr. Arun, consultant gastroenterologist and hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai. Today, I would like to show you all an interesting case scenario to a young female patient who just completed 23 years of age who presented to us with issue of vague abdominal pain on and off for the past 1 month of duration. And when this patient been referred to us for further management, when we looked into the clinical history and presentation, she had evidence of mild anemia, mild to moderate anemia. Anemia is nothing but reduction of your hemoglobin. A blood count is only around 8 for this patient. And when we decided to proceed with the upper GI endoscopy, we can able to identify a prominent worm in a small bowel, which is nothing but the proximal small bowel. This worm is also called as hookworm, is nothing but Ankylostomum duodenale. If you're going to land up with this kind of presentation, what is the most common reason we need to look into an Indian scenario? If your diet, if your sanitation, if you are having poor sanitation practices, if you're having poor inadequate access to good water, and if you are having health education, if you are not going to done properly, and this kind of presentation, if you are immunocompromised, in case if you are going to land up with HIV and other infections for a long duration of time, you may develop this kind of worm infestations in your stomach as well as in your small bowel. Once this kind of presentation happens, you need to be very cautious. You may develop severe blood loss, you may develop anemia, you may have nausea, you may have vomiting, you may have persistent loose stools, you may have persistent flatulence, you may have loss of appetite, and finally you may land up with reduction of your proteins and edema. All those complications can develop. So we need to be very cautious. We need to prevent this complication as early as possible. Screen yourself with a gastroenterologist to overcome the presentation successfully.